So what is a carcinogen? So even in the word, it's going to help you remember what it is. So the beginning of carcinogenesis, which is cancer causing. Carcinogen is anything that can lead to cancerous changes of cells. So any substance, chemical, radiation, there's certain viruses that can cause cells to become cancerous. UV radiation, anything that promotes the development of cancer. Okay, and typically carcinogens have the ability to damage the DNA of the tissue of the cells that then lead to mutations or abnormal cells, and finally the abnormal cells become cancerous. And cancerous cells are cells that are not under the control of your body. They're just growing uncontrollably. They have the ability to destroy local tissue. So not only do they move things out of the way, they destroy local tissue. And they have the ability to metastasize, meaning to spread to other organs, whether it's through the bloodstream or through lymph nodes. They have the ability to spread. Okay, we'll go into that in more detail in the upcoming slides. So let's give some examples of carcinogens. So definitely cigarette smoking is a carcinogen to many organs. So most of us will think of the lung, leading to lung cancer. But remember, the carcinogen in cigarettes, you not only inhale it, you swallow it, right? It goes to your back of your throat and you swallow a lot of the chemicals in the cigarette. So that's going to lead to some gastrointestinal cancers, such as stomach and colon. When you swallow it, it goes into your bloodstream. So it's going to affect the kidney, because the kidney filters your blood. It's going to affect the bladder because the urine sits in the bladder. Okay, so a lot of these cancers can be explained through contact with the carcinogen in the cigarette. So the mouth, basically all of the gastrointestinal tract, in particular the stomach and the colon. It can actually increase the risk of cervical cancer even. Okay. Pancreatic cancer is increased when in smokers, and definitely kidney and bladder cancer. Okay, esophageal cancer, again, because you're swallowing the carcinogens. Okay, cured foods that contain nitrates. So a lot of cured foods contain nitrates, and that is why it can lead to stomach cancer, because nitrates are irritating to cells. They can set up inflammation and lead to stomach cancer. Okay. In fact, in some countries such as Japan, stomach cancer is so common that there's screening programs for stomach cancer, just like we have screening programs for colon cancer in North America. Such as having a colonoscopy at the age of 50 as a screening test, okay, or a pap test for cervical cancer. Okay, so what else? Asbestos. Well, we've tried to avoid most forms of asbestos, especially in the production of homes, because the particles of asbestos get into the lungs. They get into the outer lining of the lung called the pleura, and they lead to a very malignant and aggressive tumor called mesothelioma. Okay, and once you've inhaled in asbestos particles, you can't get them out. They're in your lungs for life. Okay, and they set up a lot of inflammation, which then leads to a potential mesothelioma. Alcohol is a carcinogen. So Excessive consumption of alcohol can lead to oral cancers, laryngeal cancers, which is your voice box, esophageal cancer, pancreatic cancer, and it's been linked to breast and bowel cancer, and even liver cancer. And why liver cancer? Because alcohol leads to irritation of the liver, so hepatitis. We all know that alcoholics develop recurrent bouts of hepatitis, and even potentially cirrhosis years later, which is scarring and fibrosis of the liver, and then finally liver failure. But during that whole process of hepatitis and scarring that's happening over the span of years with alcohol consumption, the cells are rapidly dividing. They're trying to heal the liver. And of course, when cells rapidly divide, there's a potential to produce dysplastic cells and then finally cancerous cells. Okay. The one organ I don't see here where alcohol can aggravate is the stomach, right? Alcoholics often develop inflammation of the stomach. They have peptic ulcers because alcohol is a direct irritant to the stomach lining. Okay. Okay, so what else can we consider carcinogens? Well, ionizing radiation, which we use in testing, such as in CAT scans or X-rays, can lead to cellular damage at the DNA level, and the cells can mutate and become cancerous. Ultraviolet radiation, that's the #1 cause of skin cancer around the world, is UV radiation leading to solar damage, which can then cause the 3 types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and malignant melanoma, which is the most aggressive skin cancer there is. Okay, so repeated inflammation increases the risk that one of the cells, while trying to heal itself by rapidly dividing, creates a mutation during mitosis. And then you now have a cancerous cell. Okay, and this would include tanning beds and any form of UV radiation. Typically it's from sunlight and sunbathing. Okay, and the effects of UV radiation are additive over time. So when you have sunburns as a childhood, and then adolescent, and then into your 20s and 30s and 40s, that UV radiation has caused damage every time, and it's additive every time. Okay, there's many occupations where there's chemicals that are carcinogens. So if you can imagine working in a factory where there's a lot of different chemicals, some of them are going to be carcinogenic. Okay, there's toxins in the air, the water we drink, the soil, such as pollution in the air, pollution in water, and fertilizers in the soil, some of which can be carcinogenic. Okay, there's oncogenic viruses. So viruses can be actually carcinogens because some of them can lead to cancer, right? And we've spoken about HPV virus leading to cervical cancer, and that's why girls get the HPV vaccine. We've spoken about hepatitis B leading to recurrent bouts of inflammation of the liver that can then result in liver cancer decades later. And that's why many of us have the Hep B vaccine. The Epstein-Barr virus, which is responsible for causing mono, can remain in certain cells and lead to certain cancers later in life. Okay, so we know that some viruses are oncogenic, meaning the potential to produce cancers. Okay, there's some bacteria that are oncogenic, and H. pylori in the stomach is a perfect example. So H. pylori is that tough little bacteria that lives in your stomach that can eat through the mucosal lining and lead to peptic ulcer disease, right? And that's why we treat ulcers not only with antacids, but we treat ulcers with antibiotics to get rid of that little bacteria. H. pylori can also cause inflammation of the stomach because it's an irritant to the stomach lining. And whenever you have something that chronically irritates an area, it can lead to a cancer there because the cells are having to continually divide. So H. pylori could be considered an oncogenic bacteria. It's also an ulcer-causing bacteria. Okay, what about diet? So our diet can put us at risk for certain cancers. And a perfect example of that in North America is our high fat intake and relatively low intake of fiber. Okay, so our high fat intake and our high red meat and processed meat can lead to colon cancer. How does that happen? Well, when you eat fatty meals or fatty meat, it causes bile to be secreted from the liver and the gallbladder. The bile mixes with the fat so that it can be digested, processed, and absorbed by the gastrointestinal system. Bile acids that have been released to digest the fat are irritating to the colon. Okay, they cause low-grade inflammation in the colon, and they've been linked to causing colon cancer. So a diet that's high in fat intake and meat and low in fiber is a diet where the patient is at higher risk of colon cancer. Okay, we've already spoke about nitrosamines or nitrates from fried meats or from processed meats, leading to esophageal or stomach cancer because those chemicals in processed meat, such as nitrosamines or nitrates, irritate the esophagus and cancer, causing low-grade inflammation and then the potential to become cancerous cells. Okay. What are the risk factors for cancer? Well, obesity is considered a risk factor for cancer. Physical inactivity, genetics for sure. Okay, so our genetics determines the potential for many cancers, especially cancers at an early age. So if you have a brother or a sister or a mother or a father who had a particular cancer in their 30s or 40s, that puts you at higher risk for developing that cancer. Okay? Older age is a risk factor for cancer just by the very fact that the cells have been dividing for many, many years. And finally, one makes a mistake and you have a cancer. Immunosuppression or immunodeficiency. So if your immune system isn't constantly surveilling your body because it's immunosuppressed, say from a disease of the bone marrow, or you're taking drugs that are suppressing your immune system, then they're unable to detect the formation of cancerous cells. And then that can allow the cancerous cells to thrive and grow and become larger. So it's felt that every day we actually produce a number of cancerous cells throughout our body, but our immune system easily destroys them. Okay, so immunodeficiency in itself is a risk factor for cancer. So let's use some examples here for impaired immune system. So AIDS, you would have a impaired immune system. Okay, so AIDS patients develop cancers such as lymphomas, which are cancers of the lymph nodes. They develop a cancer of the skin and soft tissue called Kaposi's sarcoma. That's because they're immunosuppressed. Okay, patients that have received an organ transplant and have to take immunosuppressants to avoid rejection of their organ transplant, well, they're chronically immunosuppressed, so they're at risk for developing cancers later in life because of the medications that they have to take. Okay, so here's some examples of cancers or malignant neoplasms. So esophageal cancer at the top there, and the biggest risk factors for esophageal cancer is alcohol, cigarettes, and chronic reflux of acid from the stomach, which is irritating the cells, right? Gastric cancer. So gastric cancer, again, genetics can play a role in gastric cancer. It's more common in certain populations, but alcohol can irritate the stomach. Cigarettes irritate the lining of the stomach. H. pylori, which is that little bacteria leading to peptic ulcers, but it can also irritate the stomach and promote the development of gastric cancer. Okay. What about lung cancer? You can see that circular lesion there in the left lung. That's the lung cancer. And what's the biggest risk factor for lung cancer? Definitely smoking, right? Smoking is a major carcinogen leading to lung cancer. Okay, so let's just look at the following question in terms of immunosuppression or somebody who has an impaired immune system. Are they at risk for developing cancers later in life? And the answer is definitely yes. Okay, the immune system, one of its roles isn't only to protect you from bacteria and viruses and foreign substances. It's also there to protect you when cells make an error in division, right? So during mitosis, which is happening all the time in your tissue, especially in the rapidly dividing tissues of your body, if an error occurs that leads to a mutated cell, the immune system is on the lookout for that and will destroy that cell immediately. Okay, so as I mentioned before, there's some theories and thought that we make many cancers per day, or cancerous cells that are easily dealt with the immune system. So when someone has an immune deficiency, whether it's from a disease or whether it's from drugs they're taking, they are definitely at risk for long-term cancer development. They are also at risk for infection, right? If you're immunosuppressed because of a disease you have, or because of medications you're taking, such as corticosteroids or chemotherapy agents, you're at risk for developing infections because the immune system has been suppressed.